Okay, so King Charles just delivered one of the most personal and significant health updates a British monarch has ever given, and what he revealed is both medically encouraging and constitutionally profound. In a rare televised message, the 77-year-old king announced that his cancer treatment will be scaled back in the new year, crediting early diagnosis and effective intervention for his improved condition. And this isn't just a feel-good story about a cancer patient doing well. This is about a sitting monarch breaking centuries of royal secrecy to use his own illness as a platform for public health advocacy, and about what happens when institutional power meets personal vulnerability in ways the British monarchy has never before permitted. Now, let's be honest for a moment. Mainstream coverage often focuses on headlines but skips the context, incentives and power dynamics behind the scenes. That's why this channel exists, to break down what actually matters, based on public reporting, institutional rules, and how power really works. If you want to stay ahead of these stories, make sure you're subscribed. We bring context, not spin. Alright, let's get back to what just happened. Here's what actually happened. On Friday, December 13th, 2025, King Charles delivered a pre-recorded video message that aired during Channel 4's Stand Up to Cancer campaign, a joint initiative between the broadcaster and Cancer Research UK. In the message, which was filmed in late November at Clarence House, his London residence, Charles stated, "Today, I am able to share with you the good news that thanks to early diagnosis, effective intervention and adherence to doctors' orders, my own schedule of cancer treatment can be reduced in the new year. This milestone is both a personal blessing and a testimony to the remarkable advances that have been made in cancer care in recent years." A Buckingham Palace spokesperson told CNN and other outlets that King Charles has responded exceptionally well to treatment and that his doctors advise that ongoing measures will now move into a precautionary phase. The spokesperson added that this position will be continuously monitored and reviewed to protect and prioritise his continued recovery. Critically, Buckingham Palace did not say whether Charles's cancer is in remission, and the palace has never disclosed what type of cancer the king has or what kind of treatment he is receiving, beyond ruling out prostate cancer. The cancer was discovered in February 2024, after Charles underwent a procedure for a benign enlarged prostate. During that hospitalisation at London Clinic, doctors noted a separate issue of concern, and subsequent diagnostic tests identified a form of cancer. Charles entered the hospital on January 26, 2024, for the prostate procedure and was discharged on January 29th. The cancer diagnosis was announced publicly on February 5, 2024. At that time, Buckingham Palace stated that Charles had commenced a schedule of regular treatments and that he had been advised by doctors to postpone public-facing duties. Now, here's where this gets bigger than it looks. King Charles's decision to publicly discuss his cancer diagnosis represents a complete departure from centuries of British royal protocol regarding health. The British monarchy has traditionally treated royal health as an intensely private matter, sharing minimal details with the public. Queen Elizabeth II, Charles's mother who died in 2022, avoided overseas travel during her last years on the throne because of advancing age and health scares, but she never discussed those health issues publicly in any detail. The institutional approach was that the monarch's health was personal, and public disclosure would undermine the dignity and mystique of the crown. Charles has shattered that precedent. He announced his diagnosis. He resumed public engagements just 2 months later, in April 2024, visiting the University College Hospital Macmillan Cancer Centre in London, where he met with patients and clinicians. He shared stories with fellow cancer patients, telling one patient receiving chemotherapy, "It's always a bit of a shock, isn't it, when they tell you?" He has made cancer awareness a fundamental part of his public-facing work throughout his treatment. He became the new patron of Cancer Research UK and has been patron of Macmillan Cancer Support for almost 3 decades. This is not just about one person. This is about a constitutional monarch using the authority and visibility of the crown to drive public health behaviour at a population level. Charles stated in his Friday message that he has learned something that troubles me deeply. At least 9 million people in our country are not up to date with the cancer screenings available to them. That is, at least 9 million opportunities for early diagnosis being missed. So, let's break down what this really means. The statistics Charles cited are stark and unambiguous. For bowel cancer caught at the earliest stage, approximately 9 in 10 people survive for at least 5 years, according to the UK's National Cancer Intelligence Network. When diagnosed late, that survival rate falls to just 1 in 10. Early diagnosis quite simply saves lives, Charles said. I know too what a difference it has made in my own case, enabling me to continue leading a full and active life even while undergoing treatment. Charles has indeed led a remarkably full and active life during his treatment. He resumed public duties in April 2024, just 2 months after his diagnosis was announced. He hosted President Donald Trump on Trump's second state visit to the UK in September 2024. He embarked on multiple overseas trips within Europe, marking Holocaust Memorial Day at Auschwitz-Birkenau in January 2025, and praying with Pope Leo XIV at the Vatican in October 2025. According to the palace spokesperson, the king has taken great comfort and encouragement from being able to continue leading a full and active life throughout his treatment while always heeding the advice of his medical team. And this is where the stakes become very real. British cancer charities have reported that the number of people seeking information about cancer jumped significantly after King Charles revealed he was undergoing treatment. Caroline Garachty, senior information nurse at Cancer Research UK, told CNN that both Charles and his daughter-in-law Catherine, Princess of Wales, who announced her own cancer diagnosis 6 weeks after Charles, have been instrumental in raising awareness. He's visited hospitals, he's seen patients, he's visited support centres. He really has kept in touch with people, Garachty said. I think he feels, and as do other people, that he's got something in common with them. This phenomenon, where public figures' health disclosures drive increases in health-seeking behaviour, is well documented in public health research. When celebrities or prominent figures announce cancer diagnoses, screening rates spike. When they discuss treatment openly, it reduces stigma and fear. Charles is using his platform as monarch to achieve exactly this public health objective, and early indications suggest it's working. Now here's the part no one is talking about. The decision not to disclose the specific type of cancer Charles has, or the treatment he is receiving, is itself strategic. A palace spokesperson explained to CNN that the advice from cancer experts is that, in his determination to support the whole cancer community, it is preferable that His Majesty does not address his own specific condition, but rather speaks to those affected by all forms of the disease. This is sophisticated public health messaging. If Charles disclosed that he has, for example, lung cancer, or colon cancer, or lymphoma, his message would resonate most strongly with people who have or fear that specific cancer. By keeping the diagnosis vague, he can speak to everyone affected by cancer, regardless of type. His message becomes universal rather than particular. This maximizes the public health impact of his disclosure. But this vagueness also serves an institutional purpose. The British monarchy depends on mystique and dignity. Full disclosure of medical details, treatment regimens, side effects, and prognosis would humanize Charles to a degree that might undermine the symbolic function of the crown. By disclosing enough to drive public health benefits while retaining some privacy, Charles threads a delicate needle between modern transparency and traditional royal reserve. This changes the balance of power in how the British public relates to the monarchy. For centuries, the crown maintained distance through secrecy and formality. Subjects were meant to revere the monarch, not identify with them as fellow humans facing mortality and illness. Charles's approach invites identification while preserving some institutional distance. He's saying, I'm like you, I face cancer, like you do, but I'm still the king. Let's zoom out and look at the institutional context here, because what Charles is doing has implications for the future of constitutional monarchy. The British monarchy has been struggling for decades with the question of how to remain relevant in a democratic, egalitarian age. The traditional model of distant formal monarchy doesn't resonate with modern publics who expect authenticity and accessibility. But total accessibility undermines the special status that justifies the monarchy's existence. Charles's mother, Queen Elizabeth II, handled this tension by being personally reserved while being institutionally visible. She performed her duties with dedication and consistency, but she almost never discussed her personal feelings, health, or private life. This worked for her generation, but younger Britons increasingly questioned what purpose the monarchy serves, if it's just ceremonial pageantry, performed by emotionally distant figures. Charles is experimenting with a different model, personal openness in service of institutional purpose. He's using his cancer diagnosis to advance public health, which is unquestionably a legitimate function of the state. He's demonstrating that the monarchy can be useful, can drive positive behaviour, can leverage its unique visibility for social good. This is modernization through personalization, and it's a gamble. The gamble is that personal disclosure humanizes rather than diminishes. If the public sees Charles as a fellow cancer patient who happens to wear a crown, do they respect the crown more because it's worn by someone relatable, or less because it's just a fancy hat on an ordinary person? Charles is betting on the former. He's betting that authenticity and service create legitimacy. Now, let's talk about the medical dimensions of what Charles has revealed, because while the palace hasn't disclosed specifics, we can infer some things from what has been said. Charles's cancer was discovered incidentally during treatment for a benign enlarged prostate. This suggests it was either visible on imaging, done as part of that treatment, or it was found through blood work or other testing done in connection with the surgery. The fact that it was caught this way, before Charles had symptoms, is precisely what early diagnosis means. The treatment has been ongoing for nearly 2 years now, since February 2024. The fact that Charles has been able to maintain an active schedule of public engagements and overseas travel throughout treatment suggests that either the cancer itself is not extremely aggressive, or the treatment regimen is manageable enough not to be completely debilitating, or Charles has extraordinary support and medical care that allows him to function at a high level despite treatment side effects. The announcement that treatment will be scaled back and moved to a precautionary phase suggests that active treatment has been successful in controlling or eliminating the cancer, and that ongoing measures will focus on monitoring and preventing recurrence rather than actively fighting the disease. This is typical of many cancer treatment protocols: aggressive intervention initially, followed by surveillance and maintenance. It's important to note that scaled back does not mean cured or in remission. The palace has carefully avoided using those terms. Cancer treatment is often measured in years, and patients can remain on some form of treatment or monitoring indefinitely. The 5-year survival rates that Charles cited are standard benchmarks, because cancer recurrence becomes less likely the longer a patient remains cancer-free, but it's never eliminated entirely. So here's the bottom line. King Charles has announced that his cancer treatment will be reduced in the new year, after he responded exceptionally well to early diagnosis and intervention. What changed is that Charles has moved from active treatment to a precautionary phase focused on monitoring and maintaining his recovery. This is medically encouraging and suggests that his prognosis is positive, though the palace has not used terms like remission or cured. What's still uncertain is how much longer Charles will require some form of treatment or monitoring, what his long-term prognosis is, and whether his cancer will remain controlled or could recur. It's also uncertain whether Charles will ever disclose the specific type of cancer he has, though the palace has indicated this is a deliberate choice to maximize his public health impact. What could happen is that Charles continues his recovery, remains healthy enough to perform his royal duties for years to come, and his cancer advocacy becomes a defining legacy of his reign. Alternatively, if his cancer returns or progresses, he may face difficult decisions about how much to disclose and whether he can continue performing his duties. The British constitutional system has provisions for regency if a monarch becomes unable to perform their functions, but Charles has shown no indication that this is currently necessary or contemplated. Why this matters institutionally is that Charles is redefining what it means to be a modern constitutional monarch. He's demonstrating that royalty can be personally vulnerable while institutionally strong, that disclosing illness doesn't undermine authority if it's done in service of public good. Whether this model succeeds will depend on public reception and on whether Charles's health continues to improve. This story is far from over. Keep your eyes on Charles's public schedule in the coming months and whether he continues to maintain the active pace he's set during treatment. Watch for any further health updates and for data on whether his advocacy actually drives sustained increases in cancer screening rates across the UK. The intersection of monarchy, health and public service continues